Hello, I'm Dr. John Abebe, the Medical Director of Joja Abebe Fertility Center, and you are welcome to our series on our IVF process at the Joja Abebe Fertility Center. Today we're talking about post-negative test counseling. Now this is the counseling that is done for all of our patients who unfortunately tested negative after their IVF treatment program. And this is usually done 2 weeks after they did their pregnancy test. Now, why is this counseling important? Counseling is important. Why? Because this patient is hurting. This patient has so many questions. This patient is down emotionally. This patient needs a lot of psychological support. This patient needs to know what the way forward is. This patient is feeling so disappointed. So the patient needs to be counseled, needs to be seen by the team to take her through that very difficult time. And so this is the reason why this is done. And exactly what is done during this session is that the last treatment program is thoroughly reviewed. We want to find out how the process went, if there are possible factors that can be identified for the failure, and then what most likely we can do differently in the next program. And the reason why we choose 2 weeks after the pregnancy test is because we feel that time will make a lot of patients to be in a better state, to be able to have a good discussion. Because immediately after the test is done, a lot of patients whose test turned out negative are very emotional. A lot of them will be crying. They're in shock. They're not in any state at all to listen. So that is why we usually would do 2 weeks, and thereafter we'll come and then we will discuss. And it's important to note that at Joja Abebe Fertility Center, before these 2 weeks, the team would have had a review of every patient that came up negative. Yes, we do that because we normally do have our clinical reviews every Monday morning, and where we take time to go through all the patients who came up negative to find out why the result was negative and what we will do differently the next time she's going through a treatment program. So before the patient actually comes for that counseling, we already would have reviewed that patient's process, and we have determined what to do next for the patient. All right. So the patient is counseled, and the patient is we go through the whole process of the treatment she had, and a lot of times we're able to identify what could have been responsible for the negative results and what we're going to do differently. All right. There are some patients that may require some further counseling, that may require some further specialist care, psychological care, psychotherapy, because of the emotional state they are or psychological state they are at that time. But what we do at the center is to see you on a regular basis until we take you to your next program, where we are sure and we are confident that by the grace of God, this time around, the end will be different, and you'll be congratulated because you have been tested positive. All right. So that is what we do when we do our post-negative test counseling. So see you in our next video. Have a great day.